Hi, I'm Dr. Craig Castanet, and I'm going to explain neck pain to you. Neck pain is like back pain in the sense that the source of neck pain is generally this progressive degenerative compression of the neck that happens over time. Necks are very mobile. We place a lot of physical demands on them, and they wear out. The discs in particular start to wear out over the course of time as a result of wear and tear, gravity, and genetics. I'm going to show you a model in just a moment here. This is supposed to depict a low back with the bones and the disc in between, but this could as well be a model of the neck. The concept is similar in terms of what gives rise to most neck and back pain. In the case of neck pain, discs wear out because we put a lot of physical demands on them. We have a heavy head that places compressive force on these discs. We also use the neck with a lot of range of motion. The neck and the discs are subject to trauma in the way of activities as children, auto accidents sometimes, postures over the course of a lifetime. And these discs, which are made of two components, an outer ring which is made up of tough fibrous tissue and an inner kind of gelatinous component, this wears out over time, and then as these outer rings wear out, that permits this center gelatinous substance to migrate out towards the periphery of the disc. The spinal cord in the neck exists behind the disc, and nerve roots exist on each side. So the migrating material here, as it puts more pressure on the outer part of the disc, and the outer fibers of the disc itself, which are innervated with pain fibers, can be a source of pain. If the disc bulges or herniates too far out, it can put pressure on the spinal cord and be a source of pain. It can also put pressure on nerve roots and cause pain that radiates down the arm. I should note that it's very common for neck pain to be felt first in the neck and this shoulder area here, secondly in the shoulder blade area here, and lastly, as the process gets worse, down the course of the arm. So how do we treat this process? Well, what we want to do fundamentally, and this is one thing that we do that's unique at Backstrong, is most people have as part of their treatment, and a fundamental part of their treatment, the use of spinal decompression. Spinal decompression is a table we place you on, we secure you to the table. Traction was a precursor to spinal decompression. It was less sophisticated, but the concept was the same in terms of what it was trying to accomplish. Spinal decompression, once you're laying on the table, acts to separate the vertebrae to get pressure off of the disc. We know from animal studies that when you take pressure off of the disc, you get more water, oxygen, and nutrients into the disc. That makes a better environment within the disc. It encourages the cells within the disc to divide to make more cells, and those cells synthesize more of the molecules that we know are associated with repair. So there is partial disc regeneration that occurs when you distract a disc, and spinal decompression is the most effective, technologically sophisticated means we've had to do that so far. So in terms of neck pain and the generators of pain in the neck, the common sources are disc, nerve, and joint, and all of those benefit by spinal decompression for the neck as a means of treatment. We also do exercises as part of treatment, both aerobic and strengthening related exercises, and we encourage you to practice good posture. But a fundamental important way to treat the source of neck pain is to decompress the spine to provide relief. Thank you.